So, welcome to the four of you. So with some reading here, and we can continue on the line that we started this morning on the revolution of health professionals and the added element of AI. Our health system has never needed so much change. I think this is what we say repeatedly at these events at the CHAM, and it's ministers more that change and less the new professions. And over the past 10 years, some new professions have emerged. I think of the nurses in advanced practice, and we see all the evolutions on the complexity of the healthcare. And it's usually skills that we add to existing skill sets. And so women who have their own universe with skills and who are equipped with new tools and skills. When we prepared together, I was making the observation that we import of new professions that come from other sectors, engineering in organizations, that we have the DOP function that have emerged, we'll mention that, and the new technology professions that bring in new skills. So to master them, to control them is still possible. And then there's the new professions to build the new professions, whether for care, for AI, and I think of prompt engineer. So will hospitals be equipped with prompt engineers in the coming years? MLOps. Also, when we talk about AI, is at the heart of our reflection. If we can take advantage of that, and I'll turn to Laurent Alexandre, who will know how to tell us about this without triggering too much anxiety. I think you can warn us on cognitive overcoming. And I would like not just to talk about AI, but broader technological revolution coming from biology, genetics, Neuralink, CRISPR-Cas, and all these potential combined with artificial intelligence will push the boundaries. If we trust them in data, in the tools. So Lise, you'll tell us at the heading of one of the beacons who observe and animate health in innovation in health in France, and how you project with your past as a doctor in public medicine. And this only has meaning if we trust in the data to train algorithm and the tools that are tools of tomorrow. And if we manage to master the cyber risk, Karim, LAMOURI, you know how to tell us about what is the nature of the threat today, and how can we bypass it. But personally, I know that my job is going to change. It has changed already. The use of generative IA is significant. And if you want to really reap the benefits and test and make some requests on ChatGPT or Copilot, we can realize the potential and the limits, and to go beyond the wow effect of that. Evidently, I'm not the only one. I asked the O1 version of ChatGPT, and I asked ChatGPT what are the new trades: data scientist, specialist in AI, in medical AI, technician in medical 3D printing, coordination, specialist in cybersecurity, medical cybersecurity, clinical genetician, coach in health and well-being. We start opening doors that are not so much in health. Specialist in virtual reality and augmented reality. Yes, technology is not just AI. So IPA, so nurse in advanced practices. I don't know if it's new job, but medical engineering, robotics, specialist in digital epidemiology. So you see, AI has its rightful place, but you all must have wondered, yes, it's obvious that I'd already thought of all these evolutions, or you might think, no, it's not possible, or you might have thought, maybe it's a good idea, we had not thought about it, and it's part of the new professions that will emerge in the coming years. And I'll turn towards you, Mr. REVEL, heading the hospital of Paris, and your career has allowed you to observe the evolution of professions, and that's what's interesting. A very simple question to you: what are the professions that you see emerge in the future? ChatGPT has killed the match already, because it made us drew a list that it's a right list of the new professions of the emerging professions. Some are already existing. In the whole list what you quoted, everything around data, revolving around AI, bio IT, and genetic medicine, we see that there's something that's going to determine the future of medicine for the world and in our structures. Other people around this roundtable will speak better about this probably, but I'm going to move away and just assume talking about three profession skills or needs. There correspond things are fairly known, that I observe that we have increasing needs. Job professions around coordination. I'll tell you why. Transformation professions of our organizations. And the third, I don't know if I have time to develop, of living together within our organizations to cohabit, to the human aspect and team aspect. On coordination, when I look today, the needs we have when we look at how a hospital works or doesn't work, we see that the issue of intra-hospital path in the day is difficult. Beyond the doctor, the healthcare provider, healthcare giver, the need of professionals that ensure transitions, that manage capacities, beds, and path is a key element, and we lack these. And beyond that, it has been well said this morning in the debate we had on the stakes of home and remote and proximity care. What's before us in terms of demographic cliff, epidemiologics, in the context of tension on resources, pressure on resources, whether it's medical professional, and there'll be answers towards that, and financial and economic shortages, and a horizon that darkens, we see that we can fear that this topic, this economic equation, might be determined by regulation levers that we know well, close to where of cutting, the economics of cutting budgets. We have to move forward on what I think is going to help us to face this financial demographic cliff, which is quality. Quality, it means the path. It doesn't stop at the walls the walls of the hospital. The hospital will have, with the different players in the cities, a role to take, a place to take in an organization that we have to modelize. If we want at some point to stop talking about quality, path, prevention, and we've been revolving over years around these themes, which nevertheless are the only real way to care well and do that in a sustainable fashion financially, that we have economic models that will allow us to really follow patients, chronic and the long term. And these are traits that hospital has to position itself with others. And so coordination first. The second, let's say, managing our transformation, we have stakes, challenges, thousands of challenges. It's not a very agile place. And we have very concrete topics on which we're not good. How to function in the theater, in operating theater, in my organization, HP, how we spread information relevantly, how do we manage sobriety on consumption, and that today I see that we're right from the top. Sorry, there's a lot. You're one of the people who work in big audit firms and consulting firms, and you arrive with pre-made solutions. What works really is what's built with the teams, that comes from the bottom up, and think with clear directions yet. But today you talk about DOP, so Jiminy Cricket, I call them. People 30, 40, a little engineer, they did business school, they did political sciences, they are within our organization, and to manage with our medical teams, paramedical teams, to take them, to steer them towards transformation, evolution, and practical improvements. And these are professions that are very extremely precious. Maybe I'm too long, and we need people also. No, you're not too long. And you had a third point, that which is the living well together. And I've been 2 years at the APHP. It's the first time I manage a public hospital. It's both the great number of conflicts and that contribute to our organization rotting, And to what point the life within teams to feel well-being in a human environment of women is determining. And when we have a team that managed to put dialogue, project, listening, and comments, shared meaning, and how it can deregulate and drift off into a form of conflict. And so we need not just mediators, but to manage to implement in those basic units these skills to be able to talk to each other. And so these are things that you don't just decide them. How do you manage to create dialogue spaces that are structured, where we manage to talk about issues and find answers to these solutions? And we're far from AI here, and I completely assume that's fact. But within our organization, what today we live where or not. After that said, AI is going to arrive, and it's going to transform a lot of things, but it's not going to transform that we need paths that are well managed to hold the system. We need to transform, and we need to live together. So before giving the floor to Laurent, Alexandre, just the last word on AI. Potential limit. I think potential is massive. AI is coming from everywhere in our structures, and it's just the beginning. So we're going to let it emerge. We try here, we're so much approached by a whole host of companies and startups that bring solutions that we have a lot. The test and experimentation ongoing. We have to organize to make this possible, and after that, I think we have to manage to set a host of priorities on which we think we can have a quick return on investment before AI starts to help us in the clinical decision-making or the reading of imagery. There's some stakes revolving around something that's time consumption, which is generation of medical prescription. So we have to let everything sink in, to try it out, to test, and to have a clear objective on which we can move forward in a more industrial fashion. Thank you, Dr. Alexandre. I turn to you. Now, I know you don't necessarily like me to insist, but you have published a very good book. ChatGPT is going to make us immortal. So if some of us here want to become immortal, you have to read this. A little provocation, a little hint of provocation, but with the scientific groundwork. And you go through the whole history of AI. And I think in a couple of months, because your book is going to be obsolete already, I'm going to take one example. You talked about cognitive overcoming. So the last version of GPT has 120 IQ result. The average of humanity is 86. And I quote you: tomorrow's doctor will be a third nurse, a third social assistant, a third doctor. No, Kaifuri, the best specialist on AI economy. And I am against this vision. So it's not you. So 11 years of studies to become social assistant, it doesn't motivate me. So I'm going to avoid doing something stupid. So is the hospital of the future will be an IT company in 2050? Yes. So what's before us with all these revolutions? First, I think it's curious. I'm at 65. I'm closer to become at a patient, and so to ask me to plan the profession of the future is kind of paradoxical. What's most important to me is not the emergence of new trades. It's the transformation of current professions because we've been overcome by AI. It's ongoing. It gains 2 points of IQ every month, or 1 point. It's maybe going to recede a little, but we're being overcome by AI. ChatGPT is more intelligent than 90% of our staff in the French hospitals. So this overcoming is certain, but it's also so. ARC, which is a big investment company, has collected the opinion on experts on when AI is going to overcome human intelligence. So before the arrival of ChatGPT 3, the board consensus was 2,100. So now 2031, 3031. So we have a clear of anticipations linked to the fantastic progress of IT models, like such as ChatGPT, cloud. So how do we training the new trades as we're becoming overtaken by AI? If we look at all the medical doctors here and have practiced clinical medicine, there's not one who's able that can do better than ChatGPT 4. Not, as we speak, none of you is able to equal ChatGPT 4 on a medical file taken randomly. So we are in the middle of this moment of cognitive overtaking, and as Mr. Revel is saying, his mandate is the mandate of the medical, the doctor being overtaken by AI. That doesn't mean we don't need him anymore, but we have to be trained. We're gonna have to get trained to be complementary. As everyone, I've had the idea that AI plus me, AI plus a colleague will be better than AI alone. It's not true anymore. We have entered into anti-complementarity areas. Google was very disturbed to comment his study of January 2024, where they compared doctors to AI. Doctors alone have 30% accuracy on diagnosis. Doctors who can use Google search 40%. AI alone, 60% of accuracy. AI plus a doctor, 52%. When we add medical AI, one doctor, a real flesh and blood doctor like most of us here, we lose 8% of good diagnosis. So we're going to have to train, that we get trained, because the idea on which society can function, that me plus AI is not as good as AI alone, is a delirious idea. Nor doctors, nor politicians, nor moral or code of ethics will authorize such a vision. So we have to be complementary. Do we have to train people? Young people are not trained to AI. I saw president of young medical trade unions who had never used ChatGPT, so the pedagogical effort that's significant. Otherwise, you can have anti-complementarity, which is a real issue. So, the future professions of the future, we don't know them, and not you more than me or ChatGPT. We can have a few intuitions, but we're going to get it wrong a lot because technological future is uncertain. So we need extreme mobility, because the cutting by trade, by profession, is going to be transformed by AI. I'm just going to take one example. We've used in our hospital to institutions to work in silos, closed off, because our intellectual capacity doesn't allow us to know all specialties. I've never known what a fifth of urologic surgery, and it's not going to improve. We just know part of our specialty. No one is able to know all the specialties. AI is completely transverse. That's why it's crushing us today. So our organization is based on our cognitive limitations, boundaries that AI doesn't have. The questions that are going to be asked are going to be very different. From the moment the center of the hospital is going to be AI and not the doctor, is going to be able to manage a patient in all aspects. When we need to transport on a stretcher to Kremlin-Bicêtre, where I spent 20 years of my life, or the Petit-Salpêtrière, where I spent 10 years, patients from rheumatology to cardiology. AI, which is pluridisciplinary and transverse, doesn't need to transfer patients from hall A to Z. So coordination of care can be augmented by construction. AI is holistic, and therefore the generalist AI are superior to the specialized AI. We demonstrated that. It's been published recently that when we have strokes, AI educated, trained specially on stroke files are less efficient than ChatGPT 4, which have not been trained on this topic. So the specialized models are not as good as the generalist models. So it leads to a transformation of a model of closed-off medicine by silos to solutions for coordination, even if, by the way, this might be some narcissistic wounds in the phase where we're anti-complementary. So last question, maybe. You're gonna, before leaving the floor to you, you took the analogy of Alice in Wonderland look at the landscape going before you, otherwise I'm overtaken. Is there a place for France, for Europe? When we look at today, most of these innovations are mostly American. How do we keep our sovereignty? And how France plus Europe manages to weigh in this concert of technological development? We have no chance. Thank you. If we wanted to catch up the 30 years delay we have in cloud microprocessors, we're going to have to work a lot. There are some nice, we know Mistral, certain that raised 1 billion, extraordinary company. And I'm not saying that just because its founder Mensch is my nephew. He's a great guy, a great boy. So we have a few great companies. Europe is 10 years late. The Draghi report extraordinary. He takes into account the dramatic mistake of overregulation, GRPD, which prevents us to have main players in this field. NVIDIA, which is the leader in microchips for AI, is 3,000 billion worth. Amazon Research is 72 billion per year. The only Amazon, 20 times our National Research Center. So the idea that we're going to catch up with Amazon is completely ludicrous. So today, if you want sovereignty beyond the benevolent thoughts and wishful thinking and stupid reports, if you want to find sovereignty, we need a 50-year plan, not a 6 month or 1 year or 5 years. If you want to catch up the delay we have technologically, we need a European plan of over 50 years, invest a lot. The budget situation that Mr. Revel knows well is not going to allow France to go from 2.21% on R&D to 20% in South Korea or Israel. We have another issue in Europe, is that we invest in research in sectors that are not as interesting for the future, and we don't invest in the most interesting sectors. 50% of research in Europe, private research, is dedicated to automobile. In the US, 85% of research is dedicated to biotechnology and AI. 85%. So Europe invests in technology of the past. US is investing massively in biotech and AI, and so the gap is huge because we're overtaken in all the technological elements. It's a real topic. It's a taboo. Each time we make a plan for sovereignty, we make things worse. The AI Act is a catastrophe for Europe. Today, I think we need to, if we want that this continent remains rich and wealth per inhabitant is twice lower than in the US, if we want for a place for our children and grandchildren, and I think this as citizen and father of a big family, we have to catch up. Otherwise, our children in the long term are going to live in the Zimbabwe of the 22nd century. It's kind of scary what you're describing. It's factual. This 50-year plan, do you have it? Jokes aside, you're trained as a doctor. If tomorrow you have to get back to work with what we know and what we see, what you should expect? Practice is not easy. I'm trying to synthesize between the emergence of AI, the stakes of appropriating by health institutions, and so there's a lot of an appropriation that's necessary to reap the benefits of it, and the risks also, the great stakes and challenges in terms of impact of AI. I'm convinced. I dare to take a risk here with some optimism. I'm convinced that if the job professions are going to modified and transformed, I think it's also for the benefit of doctors. And maybe if I make an analogy in the field of aeronautics, yes, automation has emerged, has arrived. There's nevertheless not one. There's still 2 pilots in the plane, so which means that professions are not disappearing, to transform. If I had to get back to the hospital and work and have a vision for tomorrow, I think all the stakes on AI and impact on the organization of labor organization, management of automated reports, coordination of care, I think this is being called to be recentered on human ties with the patient, to get detached from administrative tasks, and those mentioned. It's not a description of tomorrow, that's today's description. Today, doctors are in front of screens, that's a reality. When you see it, to what extent it mobilizes and it disturbs the relation with the patient, I think it's one of the first important points on which AI can help. But beyond the simple patient-doctor relationship, I think patient to which I will be directed to is going to be treated differently. AI is called on to have earlier prevention with more detailed prescriptions and recommendations. And it's good that if AI can allow us can have this role of recenter about curative medicine, it will allow us to leave time for better care and an early prevention, precocious treatment. That's the turn we have to take. And it's good if the jobs of doctors is changing and is called on to better surround patients on coaching and more upstream. And so I think AI is a great tool of sanitary democracy that can put the patient at the heart of the system, allowing him to understand the different scenarios, to understand the possibilities in terms of prevention that's more customized, that will be directed to him, because AI will allow, on the basis of risk factors of the patient, to be steered in one or the other direction that's more adapted to its own issues. Here you talk about taking care of a patient or the whole population. As a public health specialist, how do you perceive these professions in the area of AI? I think AI has a lot to bring in public health and public policy, and to the extent that we're going to have the ability to have modelization works from AI, based on AI, and maybe again to bring in all the players in the health system according to these possible organization of care models. We're going to be more managing the whole population, and that's going to be the responsibility of deciders and public health doctors. The objective is not just to organize the offer and to know how to adapt it in a more refined way according to mobilization of data and the stakes of public health stakes that are different from region to the other, but also to know what typology of patient to put in what public policy orientation. So the profession is going to be modified. Maybe AI, in terms of public health, is called on to have sort of cognitive biases to disappear on the vision we have globally. But in the daily work of doctors, I can give you a very, very concrete example. When we look at the studies in terms of multiple sclerosis, studies have shown that women are less treated by less efficient treatments. There's a bias on the fact that women in procreation age don't benefit from the same therapeutical targets by different doctors, but it can allow AI to put some more objectivity and to have some biases to disappear in the way patients are treated. And to answer the first question in 1 minute, what new profession do you anticipate, do you see emerge? Again, there are professions obvious in terms of AI. Talk about engineering, software engineering. I'm not going to go back to this again. And I think we talk about the shortage of health professionals. I think there's going to be shortage that existing in many respects revolving engineering, I think we're going to have some barriers, obstacles to fall between trainings, because we have trainings of doctors, of engineers, and they're separate. Everything is shifting. We're going to have discussion recently with engineering schools. The boundaries between disciplines are going to have to fall or diminish. I think it's less new professions, or maybe coach in prevention, but revolving around the human aspect rather than transformation. And again, the issues that we meet with AI today are issues that men have always known in one way or the other, and it's a first vocation of humans to adapt to technological evolution. Since Rabelais, we talked about science without conscience is only ruin of the soul. And so with the nuclear, we had this other issue. We have it with AI today. I'm deeply convinced that it's our role as well as overall as those who are invested in public sphere to better accompany the emergence of this new innovation, to reap all the benefits from it and the most possible, and to build namely this possibility and this foundation that will allow us to spread innovations that are really going to bring a benefit with safeguards, obviously, and we know the importance of competitivity at the international level, but to accompany, regulate in a certain way, to allow this transformation of professions, putting the patient at the center, so that the benefits are the strongest. All this only has meaning if we can use the tools correctly. I'll turn quickly towards you. When we talk together, you talked about the dark web, and indeed a number of cyber risks that can emerge on corruption of data, the exposure of data, on the fact that the systems can be hacked. In one word, can you talk about what is the situation today of the cyber threats and the exchange you've had with the Annecy hospital, where you had to intervene on a feedback from a crisis that they had? Yeah, the dark web is kind of the consequence. I think that I'm going to be less scary and worrying, because I'm at a table of doctors. I'm just a computer engineer here. Dark web, we find everything there, from the simple to the most awful, and it's kind of worrying. We're going to have to start checking data that concerning health data, medical data, concerning patients from institutions, whether it's clinics or hospitals. Public institutions are not found there, are not exploited. So you have to be able to call them on and to make sure that sometimes negotiate with the people in front to say this is dangerous, there are children, you have some moral groundwork and ethical, and you're going to have to delete that, or call authorities, Interpol and law enforcement, to do the work of checking, to stay in this context of and this is going to be more in the health realm. And that's another topic. With a friend at the Annecy Hospital who asked us informally help on the understanding of what can paralyze, what can block a hospital when they are victim of a cyber hacking. We're all dependent on smartphones and computers, and it's very complicated to function without an IT system when it's paralyzed, when it's in breakdown, or it's quasi-impossible. So we're the youngest on Earth, but we're going to maybe talk about some older people. We're going to have to master paper and pen, because it's a fatal weapon. It's a lethal weapon when you know what's a white plan. The cyber white plan is good because it goes back to the fundamentals, to the sources, and have a different view than Dr. Alexandre. I think that doctors and humans are still important, and that they have to learn to do without technology. Technology is good, but we're too dependent. You spend your time taking the car to go shopping, to work, and there's an effect on your body. But the fact that you're completely dependent to do well is better. We want to go faster. We want to care for more people. We want to welcome more and less personnel. But there's answers to that. Chinese robots that are coming to Europe are robots that are nurses. They're already out of the labs, they're being experimented. When they're going to arrive in Europe, we're going to have an answer to all the issues of immigration, qualitative immigration. We need a strike force that's strong. And robots, and this is not AI, I'm talking about automation here. Do we take the full measure of what's happening right now? We have trouble functioning correctly without entering to the race for AI or technology, without entering those debates of competition towards other countries that can do better. Do we know how to do well and simple? If we're paralyzed through cyber attacks, I'm talking about just a cyber hacking. We want to learn to do AI, but you cannot secure your workstation. We have to go back to the fundamentals. I make a parallel. Our friend of Zimbabwe are not going to like the comparison, but I think that the threefold approach is the one-third computer engineers, one-third doctors, one-third social assistants, social workers. I'm not going to denigrate the social worker because he has a fundamental role, and I pay homage to all the doctors here. I will entrust my life to humans and not machines. And it's a human that's speaking and that talks to a machine every day. And a machine, it can be compromised. A machine has no empathy. It's going to fake it. We were calculating with the 4.0 ChatGPT. We're in a model of reasoning. The machine can reason. So now no machine is going to tell me, I love you, and I'll do everything to save you, because I cannot describe what I feel for you. Today a machine does that. We'll talk about it. I don't care about being immortal. What I'm interested in is to live with dignity, quietly, peacefully with humans, with the help of technology. It's a plus. It's going to improve. My parents are two analphabet Moroccans who arrived in Nanterre in a shanty town, and they had 5 children that learned to learn with humans in France. So I'm French Moroccan, and I can guarantee you that what's going to tie us together and save us is much more our human interactions than the interaction we have with machines. So we can say AI with it. I'm a computer engineer. So I work every day with cluster, with Chinese, Russians, Americans, Israeli, Moroccan. I work with the whole world plan. I can guarantee you that what's going to save us is our ability to exchange information, to understand them, to understand each other as humans, and then we'll try to do with machines. But if among humans we have trouble understanding each other, to find refuge in scenarios where your granddaughter is going to be 400 years and you will be immortal and after. Mr. Revel, a little conclusion? Just on cyber risk, it's a risk that you look at. Let's stay on that. Yeah, just to answer, yeah. We look at it very closely. We know that earlier or later we're going to be caught up with that risk, and we try to prepare ourselves and try to limit the vulnerabilities and to relearn, to retrain the teams to do how we do it without computers. And those who followed the summer news, at the PHP, we did a big grand-scale exercise over a whole weekend that was not planned, linked to the fact that the data center in which we host our data has unfortunately had a breakdown, computer breakdown, that led us to have litigation against those providers. And so when we worked on that, and the cyber crisis, we were expecting a cyber crisis during the Olympic Games, and it didn't go as bad. So that's for cyber risks, and we'll have AI. I'm going to do a vague synthesis of what to reconcile everyone. I think AI is coming, it's here. And I think it should be an opportunity. And once we said that, the patients will wait to get in front of not an algorithm, but doctors. And we know that the effect of having this trust, full relation, this attention in humanity is part of therapeutics. And we'll try not to oppose these two. And to finish with a big idea, we see that there are massive transformations coming. And the issue for me as a director of a public hospital is to see how how the country, the health system, is able in the coming time to make shift those organizational financial models without which we'll remain in in the expectation. So we thank you to all of you, to the four of you.